आप वो प्रोजेक्ट कर दोगे जो मैंने आपको स्क्रीनशॉट दिया है?
We are live, sir.
डॉक्टर प्रवीण, डॉक्टर प्रवीण आवाज आ रही है मेरी?
हाँ या बिल्कुल आ रही है। ठीक है, प्लीज स्टार्ट।
ओके ओके गुड इवनिंग एवरीवन। आई होप वी आर ऑडिबल। जस्ट गिव मी अ सेक। Yeah. All right. So another exam is over, and I'm sure that सब लोगों ने फोड़ दिया होगा exam, and specifically the students who are working very hard. So before we go forward and about talking about some individual subjects, Dr. Praveen, can we just show the screen and the level of difficulty of the paper that we captured from the students? Can you share it with on the screen? Yeah. So I mean, there is a broad, small poll that we did on the Telegram, and 10% of the people have found the paper easy, 30% average, 40% tricky, and 20% hard. But before I tell about this, I will say कि ये standard है. I mean, if I talk about the analysis of the exam, I can give an analysis of the exam even before the actual exam happens. The rule is very simple, guys. In today's time, anybody who is reading, anybody who is sincerely working will definitely be able to crack the exam. It's as simple as that. Anybody who has focused on one particular set of books, one particular set of lectures, and focusing and reading well for 4-5 months is definitely able to get more than 150 correct in the exam without a doubt. इसमें कोई डाउट ही नहीं है. I am very sure on this particular part. Dr. Praveen, what do you say?
Yeah, surely. I think that's the truth, the part of any exam. The paper looks to be equally easy and equally hard, and it all depends upon the level of preparation that students have been doing. And since most of the FMG students are very hardworking, what I've realized in their understanding pattern. So an average score of 30% and tricky of 40%. I think the tricky part is mostly because the questions were twisted a bit. They were very clinical based questions. They're not very straightforward questions as we usually expected to be in FMG exam a few years back. And so that quietly is like very much understandable. When a question is a straightforward question and has 4 options to pick up, and with the question often being where the following is true, it becomes a straightforward question. But nowadays what we are seeing is the number of clinical questions have increased, the understanding part has increased, and they mostly talk about what is the next step of management, what is the next step of diagnosis, what is the next thing to be done, and that what makes the questions more and more trickier. And I would believe that more of an FMG exam, what I realized was this was looking like a PG, I mean NEET PG exam. And I could say that any students who is actually preparing for the NEET PG would also find this paper not very easy. Even though the 10% polls does say it's easy, but sir, my assessment of the exam was it's more of a tricky one. I would maybe I would be in 20% part also, but yes, 40% is where I would like to put myself into. I will feel that question was actually tricky.
Yeah, no, I completely agree with you, and I think that one of the biggest thing that started happening is that they have started removing the gap between the NEET PG and the FMG screening exam. I mean, there was a time when the NEET PG exam used to be very difficult and the FMG exam used to be very easy. Now they are probably decreasing that gap, and more of a clinically, or I will say slightly twisted kind of questions they have started putting up in. जैसे पहले पूछते थे कि अगर मैं रेडियोलॉजी के क्वेश्चन की बात करूं कि एक इमेज दे देते थे एंड they used to show a hematoma and they used to ask, okay, what is a hematoma? What is this? Is it EDH, SDH? इस बार उन्होंने EDH देके पूछा इसका मैनेजमेंट क्या है वो बता दो कि क्या करेंगे इसके अंदर, है ना? So those kind of tricky things that they have started asking. अब नॉर्मली पहले क्या करते थे, क्वेश्चन देते थे कि चलो बताओ पेशेंट को हेमीपेरेसिस हो गया, now what is the next step in the management? This time they have given a typical NEET question. An NCCT was given, there was a hemorrhage, and the question was, now tell me what should not be done in this patient. Though we were fortunate enough that we have told this to the FMG batches also in the classes that कि भाई अगर hemorrhage है तो thrombolysis contraindicated. So those kind of questions that they are now asking in the paper. But one thing is very, very clear, guys, that I am saying that if you have done your homework well, that you can get 150 marks in the paper. You can definitely get 150 marks in the paper. Yeah, I agree. And one more thing is that OBG was a lot of OBG was there. A lot of integrated questions were there. I mean, what is your take on integrated questions, Dr. Praveen?
Yeah, sir. I could see that a question could have been asked in a simple way. The following would be causing a delayed wound healing, but instead they asked in a different way. So that was a question also on delayed wound healing, and along with that, they put some other points also in that, and like it was diarrhea and dermatitis. So that completely changes the scenario. And the options were also like they put one of the option which a student would always mark, that's niacin, but that is how they have tricked the entire paper. I could see a few other questions like it was quite mixed with medicine, and so my thought process when I saw the paper was it was not looking like to be a very simple paper to me at all. It was not looking to be a very straightforward question, and I think the FMG students now should understand that they have to prepare in a better way. I am very sure they might be preparing also, but the preparation standard is no lesser than NEET PG or I'll say IICT at all. Maybe because the examination pattern, examination body has become same. So they feel that this question can also be given to the FMG students. And I don't know how would they like to take it forward. This is just an passing exam. So initially my thought process would have been to make a paper easy, but I don't think, sir, it's so simple actually.
Yeah, no, I agree. And I think R has written it right. The recall questions language was easy. Actually, recall questions were not easy. Recall were recall question. Anybody who has done the recall knew the answers. But the new questions, the language was, recall language was easy. Yeah, but the real exam languages were tough. Yeah, I am getting different kind of recall that is from the students. So I think I agree with you on this. DVD, I could not understand your statement, Bache. Level of teaching is day to day dull. Can you just slightly explain it better? But yes, I feel a lot on this that now they are decreasing the level of between the NEET PG and the FMG screening exam. In fact, a lot of questions which were standard NEET PG questions are directly being asked in this FMG screening exam. All right, so message and suggestion for all of you guys. You people have given the exam. Your fate is sealed now. It cannot be changed. Whatever that has to happen has happened. Enjoy your day without a doubt. अच्छी तरह enjoy करो. Let us pray from the God. We will also pray for all of you that you should pass the exam. है ना? इस exam का सबसे अच्छी बात ये है that you are not competing with your friends. And it's a pass and fail exam. So pray from the God that you should pass the exam. है ना? Don't pray कि मेरे 200 नंबर आ जाए, 250 नंबर आ जाए. Just एक simple pray करेंगे that God, I should pass the exam. That's all. And enjoy for few days. Let us hope, we will pray from the Almighty that all of you should pass this exam. All of you should pass this exam. If something happens, we are there for you. We will try our level best that we can provide you a support in whichever capacity that we have. But yes, it was a difficult, I will say, a tricky paper, and I'm sure that if you have studied well and you have handled the tricky questions in a decent way, you will be able to pass the exam. Dr. Praveen, over to you.
So guys, sir, I would just like to discuss a few questions that I could find as of now, and I would like to discuss with you also.
Yeah, sure. Go ahead, please.
So guys, one of the question was asked on the celiac sprue, when the question was whether the following can be given, and the options I got was suji, rice, wheat, and oat. A simple way that what we teach actually is that the celiac sprue actually is due to bro, that is barley, rye, oat, and wheat. So obviously, what should not be given, because suji also is made up of wheat products, so we should not give suji. Rice is always safe, and this is how also we make a thing very simplified, that the brome R is rye, not rice. And so what can be given is the product of rice, and that is safer for a celiac disease. I would request all of you to put any changes in the recall if you find any. Okay. Now this was a question of calcitonin being marker of which of the thyroid disease. Remember, calcitonin, that is a cal deposition, actually is seen in a medullary carcinoma thyroid. Just to recall few of the important questions that is often asked from this, and that is like papillary is the most common carcinoma of thyroid, follicular often being seen in the multinodular goiter, and anaplastic being the poorest prognosis. A few other questions that you students should remember is that radiational induced cancer of thyroid is actually papillary carcinoma. And if you remember the orphan nuclei on all those finding of dystrophic calcification can be seen in papillary carcinoma. Medullary carcinoma thyroid is a neuroendocrine tumor, and it often shows a calcitonin deposition, which deposits as A-cal, and therefore that answer becomes a A-cal deposition here. Third question I got was 47XXY. What is the wrong statement? Remember, this talks about a Klinefelter syndrome. Now, Klinefelter syndrome, how you must remember is there's a 47XXY. So that's a male, and along with that, there's a one extra X. So male mein agar ek extra X hoga, then the testis will not develop properly, because of which the testosterone value will be less, and because of which the LH and FSH ratio will always be increased. LH is high, FSH is high. A male having low level of testosterone, so the estrogen-testosterone ratio will be higher, and that can lead to also gynecomastia. So in this, as you can now understand, it would be surely decrease, and should not be decrease FSH. It should be increase FSH, and there can be azoospermia because of low testosterone value. Decreased testicular size can surely happen, and they can also lead to hyalinization of Sertoli cells. That means the testis is not developing properly. Now this was, I don't think this is a complete question, because this looks to be a bit, both of them can be the answer as of now. It is infertility with respiratory infection, the most common infected part. So something is wrong, I think so, because infertility and respiratory tract infection can be seen both in cystic fibrosis and as well as celiac dyskinesia, that is Cardinal syndrome. So I would actually require some more history. I'm very sure might be have been given here.
Or there must be some more information that must be there in the question.
Right, I think because as of now it looks to be both one
या
and
तो
two.
हो सकता है कि साथ में वो भी दिया हुआ साइटस इनवर्सस दिया हुआ कुछ ऐसा दिया हुआ.
Yes, so I would just request any students who has joined us to just put any message on this, and maybe we can recall it in a better way. देखो Down syndrome में how we teach is a problematic situation, is a mnemonic for Down syndrome, and it is actually which show semen increase. A common finding you must always remember, that's what are the facial anomalies of Down syndrome. It's a mongolized slant, that is the inward medially shaped eyes, and along with that they also have the medial epicanthic folds. They have a depressed nasal bridge. Along with that, in the palmar crease, what happens that the both the horizontal crease actually fuse to form one single crease, and that is what makes the answer here as semen crease. Along with that, they can also have clinodactyly. A few other questions that can be asked here, and that could be related to the most common cardiac defect. It's endocardial cushion defect of atrial septal defect. So that should be there. Now, a patient has gum bleeding and decreased absorption of iron. So in this, the question was asking about what can lead to gum bleeding. So yes, what students may not know that vitamin C deficiency can also decrease absorption of iron. But I think gum bleeding is what most of the students can understand is due to vitamin C deficiency. A similar type of question I could also see. So that was a very tricky question. And I would just read the question. So the question was talking about deficiency associated with poor wound healing, dermatitis, and diarrhea. And that was a question along with which the option was given as niacin. But please understand, if the question is talking not of the problem with dementia, So that can't be niacin deficiency. It has to be then zinc deficiency. Poor wound healing has to be with zinc deficiency. Zinc and copper, if you remember, are the cofactors for metalloproteinase, and that makes it that as the answer. Now, this is a nutmeg liver, and the question was asking you that a patient has edema, raised JVP until mandible, and has ascites. What is the likely cause? Often this occurs due to the cardiac failure, and because of this, the liver also has this type of typical morphology, and the typical morphology here is called as nutmeg liver. Nutmeg liver is a very interesting finding in which there is a necrosis near the centrilobular area, and the peripodal area gets fibrosed. Look at this typical finding of, the typical finding of this red and white color. The red color indicates the necrosis, white color indicates the fibrosis there. Okay, so I would request if any of the question till now was not properly recalled, and we can also discuss a bit more on this. I think that question that we got, sir, there was cilia sterophilia was seen. Celiac cardinal syndrome. It looks at that.
Dr. Praveen, meanwhile, some questions I can also share, though I cannot share my screen presently, but I can just tell that there was a question on pheochromocytoma where urine meternephrine level was given that it was increased and which scan has to be done. So I think you all know from your notes that MIBG scan has to be done for the system for the pheochromocytoma. Another question, which was a direct question from the double bubble appearance of duodenal atresia, and I think you all have done it right. One was a direct repeat from the January FMG screening exam, which was the CT scan of horseshoe kidney, and I think all of you have definitely done it correct. There was one question, I think, where the image was given of pulmonary embolism, and the question was about that which additional test has to be done, and I think you know that D dimer has to be done in that case. Hemorrhagic stroke, thrombolysis should not be performed is another question, and an image of EDH where the craniotomy, or I do not know the choices. Probably, if you can tell me the choices, I will be able to tell you the better answer. Some students have told me there were few questions related to the radiation also, but I am unable to get the exact recall. If you will give me the exact recall, I would be happy to tell you the correct answer of those. But yes, the questions were from the straightforward topics, but the choices were tricky. And for some of these, for a lot of students, I will not say some, for a lot of students, it was difficult to pick up one correct answer out of the two choices, and that was the challenge. Dr. Praveen, over to you.
So, guys, I think please recall the questions also for us, and if you can recall it on the DBMCI Premier Group, that's a Telegram channel, please put that questions there. In fact, the questions was also on pedigree analysis. You always insist on knowing a pedigree, and that's one of the questions that should be recalled. If you can please get the question there, it will be very easy for us. One more question that I got was on hemolytic anemia, and the question was what type of hypersensitivity reaction it is. So hemolytic anemia is a type 2 hypersensitivity reaction. Please know this important point. Now, one question was, so I think it is a question linked to probably radiology. It was a suprarenal mass which has an episodic headache, palpitation, and sweating. This points towards a case of pheochromocytoma. Remember, pheochromocytoma is a neuroendocrine tumor again, and since because of the increase of epinephrine, norepinephrine, the patient often have headache, tremor, palpitation, and sweating. These patients have to be diagnosed by a screening test called as urinary meternephrine. 24-hour urinary meternephrine is the best test there, and the histopath of that often shows a Zell-Wellen pattern. Often the question that can be asked extra on pheochromocytoma points towards the staining that can be used here, and that is apophysin chromogranin, neuron-specific analysis. To diagnose pheochromocytoma, I think Dr. Rajat would be talking about this. Sir, can you please talk about 2-3 lines on the diagnosis of pheochromocytoma from the radiology point of view?
Yeah. Hello.
Yes, sir. Pheochromocytoma
Yeah.
diagnosis points.
हाँ, तो फियोक्रोमोसाइटोमा देखो, दो इंपॉर्टेंट एस्पेक्ट है फियोक्रोमोसाइटोमा जो क्वेश्चन एग्जाम में आया, द आंसर वाज MIBG. द न्यूक्लियर स्कैन दैट इज यूज्ड फॉर फियोक्रोमोसाइटोमा इज MIBG. But if I'm going to go to more depth of this particular topic, 90% of the pheochromocytomas are adrenal, but 10% are extra-adrenal. And if it's an extra-adrenal pheochromocytoma, then DOPA PET is a standard investigation. Adrenal pheochromocytoma can also be localized by MRI.
Now, a few other questions. One was primary vision lymphoma. Primary vision lymphoma is a tumor which is often seen in diffuse large B-cell lymphoma and is often seen exclusively in HIV patients. And it is caused due to a human herpes virus 8 infection, remember. So the answer to the question of primary vision lymphoma will be the human herpes virus 8 infection. It is seen exclusively in HIV patients, actually. One question was a patient having elderly male with a backache and has increase in serum calcium level with lytic lesions, and this points towards multiple myeloma. Hypercalcemia is often seen in multiple myeloma, so that would be the basic answer there. Okay.
All right, guys. So that's broadly about the analysis. If you give us a better recall of the question along with the choices, we would be able to recall it better for you. Please put the question on DBMCI Premier group on Telegram channel, or you can put it onto my Telegram channel at Rajat Radiology Review, or you can put it onto Dr. Praveen's channel also, whichever you can easily find out and which one you can put it. Please do share the question and we will try to find out the best answer for you. But relax for few days, as your fate has already been sealed for the exam, and let's wait for the result to be announced soon. Most of the results are coming very very early nowadays, so let us hope that the FMG screening exam result is also announced soon, and we will once again pray from the god that you all pass with the flying color. All right, so that's all from our side in this short session. May god bless you all.